Tonight on Greater Boston, I'm Liz Neisloss in for Jim Braude. And with the White House marking 1 million COVID deaths and case numbers once again on the rise, we're looking at where things stand and what we can expect in the days, weeks, and months to come. Plus, a local doctor on his new book, Song of Our Scars, about why he believes pain, especially chronic pain, is still so misunderstood in the medical community. Then later, 23 years ago, a woman gave $100 to 2 young refugees she just met on a plane. A few days ago, they were reunited and join us to talk about how that single act of kindness changed their lives. Ahead. President Biden and other global leaders gathered together virtually today to discuss the state of COVID, more than 2 years in, and he marked a solemn moment for Americans.
Today, we mark a tragic milestone here in the United States. 1 million COVID deaths, 1 million empty chairs around the family dinner table.
It's a milestone we once saw as unimaginable. And as Dr. Anthony Fauci said on Boston Public Radio this week, the White House is hoping to stop the continuing climb.
Hopefully, the enormity of that number would spur us on to do whatever we can to make sure that we don't have as bad a time in the coming months and years.
But the current reality is case numbers are again rising nationally. And here in Massachusetts, we've been seeing an increase in both cases and hospitalizations for weeks, leading some to reconsider those mitigation efforts we've dropped in recent months. So where are we now with the state of COVID and what's likely ahead? I'm joined by Dr. Sabrina Assoumou, assistant professor of medicine at Boston University School of Medicine and an infectious diseases attending physician at Boston Medical Center. Dr. Assoumou, thank you very much for joining us. A few weeks ago, you said we were at somewhat of a precarious moment. Students were coming back from breaks. And now they are in school. We're seeing cases rise. How do you interpret what's unfolding right now?
Thank you for having me on again. Unfortunately, we are back here again at a time when cases are rising. And, if you look at all the indices, if you look at the wastewater, you look at the number of cases, you look at the test positivity, we are at a point where there's a lot of COVID. If you look at Boston, the test positivity rate this week was 10%. And we knew that anything higher than 5% mean that there's a lot of COVID. So unfortunately, there's a lot of cases right now in the community.
But what kind of faith are we supposed to place in testing? Fewer people are going to get testing, and when they test at home, numbers aren't necessarily being reported. I mean, I have family members, friends, not just in Massachusetts, but in neighboring states who are having, multiple breakthrough cases. So even anecdotally, you have this sense that there's a lot more going on than is being reported. So how much faith should we even put in what's being reported right now?
That's and the point that you're making about testing is actually really correct in the sense that we're missing a lot of cases that are not being reported because they're being done at home through rapid testing. So first of all, a lot of rapid testing is actually good news. I want people to test. I want them to know their status so that they'll isolate. But unfortunately, we're not recording those numbers. And so it's really hard for us to know what is going on with cases. But fortunately, we have other tools. We now have wastewater, which is actually a nice way to know what's going on in the community because it doesn't depend on people actually getting tested. And so we're at a point where we can use a lot of different tools. We could use wastewater. We could also use, what a hospitalization's doing. We could use deaths to kind of figure out where we are going right now.
So in the past 7 weeks, we've had cases rise among students, among teachers, and we kind of have a mixed picture of wearing masks. There are more than half a dozen municipalities that have said, okay, masks in school once again. So what do you think should be done at this point? Is it really just too confusing? Should we be doing this uniformly? Is this sort of patchwork approach the right way to do things?
This is a very good point. We're getting, different municipalities doing very different things. I think that, first of all, where are we in this pandemic? We're in a pandemic where we've actually learned a lot. We have a lot of tools. We actually have vaccines. There's a point, if you talked to me in November 2020, before we had vaccines, I would have told you early on that we weren't even sure that we were going to get something that was going to work. So we have a lot of tools. We have vaccines that we know work. We have testing, which you mentioned earlier. We know that high quality masking works. And we also know that we have these new outpatient treatments that also work. So the way I like to think about it is, when cases start rising like right now, it is even more important to use a layered approach. We continue to recommend that people get vaccinated. We also recommend that people wear high quality masking in indoor settings. I know that a lot of people don't want to hear this, but when you're in a time when cases are rising, it is really key that we use all of the tools in our toolbox, including masking in indoor public settings.
So speaking of vaccinations, we have some numbers that we can put up about vaccinations and booster doses. In the United States, about 30% are fully vaccinated plus at least one booster dose. In Massachusetts, a little better, 44%. But are we at a point where the messaging about boosters needs to be much stronger? It feels like if immunity wanes after the boosters, we're just on the edge of yet another cliff if that message sort of disappears.
Yeah, no, this is a very important point. What we've learned is actually that booster, if you're eligible for that booster is not like an extra dose. I think that when we refer to, let's say, 2 doses of mRNA as being fully vaccinated, a lot of people get the sense that the booster is just extra and I may not need it. But what we've learned is that booster dose is actually very critical to providing a high level of protection, especially with Omicron, and especially when we're seeing waning immunity. So I agree with you that it's time for a reboot. We really need to let everyone know that boosting is going to be critical to getting us to the other side. So if you are eligible to get a booster, please get boosted.
And what should we be focused on now when it comes to our attitudes toward COVID? I mean, I think it's certainly understandable that people relax. You have nice weather coming. People feel like, okay, I know this virus. I know a lot about it now. If I get it, the cases seem to be milder, the hospitalizations maybe not quite as severe. What are we really risking in this picture? Is it really, we should really focus again on subvariants, on new variants, on long COVID? Should we still be focused on those things?
Yeah, no, there's still so much that we don't know. And it is true that what we're fortunate about is that the vaccines that have allowed us to turn something that used to be so deadly. I mean, if you talk to me in the spring of 2020, we had nothing, and we didn't have vaccines, we didn't have appropriate treatment. So all the technology that we have has transformed something that was so deadly into something that's manageable. If someone has, a COVID infection after being, fully vaccinated or boosted, and they have mild symptoms, it's actually a win. And so I think that it is important to emphasize that our vaccines really work. And the way that we get out of this pandemic is still by continuing to vaccinate and boost as many people as possible. And the second message is, when cases start going up like they are right now, we need to emphasize the importance of using a layered approach. We cannot just rely on vaccines. We have to rely on masking, high quality masking in indoor public settings. We also need to rely on testing and using pretty much all the tools that we have so that we can get over this time period when there are a lot of cases so that we can try to relax some of those measures. I guess my other message is, pandemics end. This one will end too. But the way that it ends is actually, it would end when we decide that we're going to use all those tools and continue to use them so that we can get our cases really low so that we can get to the next normal.
Yeah, I think we have a battle right now, though, with fatigue as we talk about what's happening now, a surge that may happen again in the fall. Recently, there was a flurry of attention on Paxlovid as a treatment. A lot of people were saying this should have been really publicized much more. But now we're seeing stories about this treatment, after this treatment, seeing rebound cases. How should people view this treatment right now? Should they worry about that?
So as someone who's looked at the data, and actually as someone who was a clinician in the beginning when we had nothing, Paxlovid is a phenomenal medication. To have a drug that you can give to someone who's at high risk and decrease their chances of needing to be hospitalized by nearly 90%, That's phenomenal. So we need to use it as much as possible so that we can prevent people from needing to be hospitalized. What we're seeing is what looks right now like rare cases. If you look at the clinical trial, it seemed to be as low as 2% of people who seem to be getting recrudescence of symptoms. We don't really understand what's happening there. We're trying to understand it, but it is a very safe medication. And if you are eligible, please don't hesitate, take it. Because it really, in the clinical trials and what we're seeing in the field, it's really a drug that works very well.
Dr. Sabrina Assoumou, thank you for helping us put that all into perspective.
Thank you for having me on.
Pain is a big part of the human experience, but it's also extremely complex. And for an estimated 50 million adults in the U.S. living with chronic pain, it's consuming. As is told in the new book, Song of Our Scars, The Untold Story of Pain. The author is Dr. Haider Warraich, who joins me now. He's also a physician at the VA Boston Healthcare System and Brigham and Women's Hospital, as well as an assistant professor at Harvard Medical School. Dr. Warraich, thank you so much. You came to write this book out of your own personal experience. You were exercising while you were in medical school and weights fell on you and I believe you injured a disc, you ruptured a disc in your spine, and that sent you on a path of chronic pain. Have I summarized that accurately?
Very accurately, and I'll take it from there. I was a young medical student who thought I was invincible and immortal, and who had gotten hurt before, like so many of us have. But before this, every time I'd gotten hurt, I'd gotten better. Even though I had pain, even if it stayed for days, sometimes weeks, it went away. But this time when I hurt my back, those days became weeks, and weeks became months, and months became years, and my entire life changed in a way that I could never have imagined. All the dreams that I'd had of even becoming a physician seemed to be slipping away from my grasp. And eventually, though I got better, after a while, I realized that while my story was important, there was a much bigger story to be told, and that's the story of people in pain and of pain itself.
So your book, it dives into the history of pain, the biology of pain, the management of pain. Why do you say the experience of pain saved my life?
Well, in a way, it saved my life because before that, I had no sense of what real suffering can be. And in a way, that is so central to knowing that as a physician. As a physician, we are faced with suffering all the time. And it's too often physicians and nurses and other clinicians have no experience of that type of illness that they're treating themselves. It's almost like they're chefs at a restaurant, but they have never tasted the food.
And that's one of my favorite quotes in the book, I have to tell you. I sort of stopped at that. And I do want you to dive more into that. What does that mean we should be doing? I mean, the oncologist should have cancer, or, maybe I'm taking it too literally, but
it is unfortunate, but sometimes it does take experiencing something to really experience the full dimension of it. And I don't think that I'm a cardiologist, and I don't need to have a heart attack to best treat patients who come in with heart attacks. If you're an oncologist, you don't need to have that experience to be able to pick the best treatments for your patients. But I think for pain, because it is so subjective, because it is something that can be so essentializing, and because it is a phenomenon that we really don't understand as well as we do things like heart disease and cancer, that I do think that my brush with pain, more than a brush with pain, did change me in some ways for the better, because it gave me a window into the suffering of others that I just didn't have before. And what I want to do through this book is make sure that others don't have to undergo something that I did to have the similar perspective when they treat someone who has pain.
So you have a pretty damning view of the way this country treats pain. You say that drugs are ineffective for chronic pain. You say we focus too much on completely eliminating pain. Can you elaborate? What is wrong with the system?
Where do I begin? I think one of the things that became very clear to me that I didn't know, even though I treat patients with pain, all the time, and I've had pain myself, was that chronic pain, which is actually very different from acute pain. Acute pain is the sort of pain you might have after, let's say, you break your arm or bruise your ribs. But chronic pain, which is something that 1 in 5 Americans and people around the world live with, is a very, very different process. And that many things that work for acute pain quite well actually are not that effective for chronic pain. The example that comes to mind is, for example, opioids. Opioids are powerful painkillers that are some of the best therapies we have for acute pain. And yet, when it comes to chronic pain, even though they help some patients, the best studies suggest and reveal that in most cases, they actually increase how much pain people have over time. And to me, this is there's been so much talk about the opioid epidemic, but what we haven't talked about is how we got here and what is next, especially for people who live with pain, and how best we can treat them. And one of the other issues with our health system is that it has become, unfortunately, so focused on profits and efficiency that the human element, which is so critical for the person in pain, has gone altogether missing. And I think for us to be able to treat the person in pain better, to understand pain better, we really need to make sure that patient-centeredness is not just a buzzword we can put on billboards, but really something we can integrate in our health system.
So where does that come into play, and how do you put that balance back? Is that about talking about empathy more in medical school? What is it that you're suggesting? I mean, taking power, moving it from pharmaceutical companies, that's a pretty big ask.
Well, so empathy is something that has been shown, in fact, to be extremely effective when it comes to helping people heal from pain. In fact, empathy is the reason why people experience the placebo effect. This idea that someone cares about them and the hope that they will feel better is really central to our body's own ability to provide us pain relief. But it's not. But interpersonal empathy is just not going to be enough. Our health system, because it prizes profitable procedures or things that we can do fast, like prescriptions, ensures essentially that we just never get time to spend with patients in the clinic or in the hospital. And so the first thing that I think physicians need and nurses need is more time to spend with their patients, because just the act of telling their story can be something that can heal the person who suffers. But the other thing is that we actually know that there are so many other therapies that are extremely effective for people in chronic pain. And that is what we need to do, is that we need to increase how much access patients with chronic pain have to all these other alternative therapies that we just haven't provided so far.
So I do want to ask you about those, because you talk very specifically about certain things. You talk about something called pain acceptance therapy, which to some people might sound like just giving up, counseling you to turn away from potential options. Can you explain what that means? Pain acceptance therapy.
Sure. So, one of the things that pain does is that when pain is the loudest alarm that can go off in your body. So as soon as we are in pain, our entire attention is focused on it and making sure that we can eliminate it at all points. That's really how I felt when I was in pain. My main focus was to make sure that I'm never in pain. When my friends would go out for birthday parties or dinners, I would rather just stay in my bed. I would just rather stay in my dorm room, because I just couldn't bear the pain of just getting in the car or being around other people who seem to be doing just fine. But what pain acceptance does is, and it's not the same as resignation. What pain acceptance does is that it shifts the person's focus not so much from trying to control the pain at all points, but to maximizing how they live their life. So what that essentially would mean for someone like me when I was suffering was someone would talk to me and tell me that even though it might hurt to be in that car, even though it might hurt to be at that birthday party, that I should not limit my life just so that I can stay pain-free. But the other thing that even newer forms of therapy, such as pain reprocessing therapy, are doing for patients with chronic pain is that they're taking the fear away from pain.
Okay.
For many people in chronic pain, the strongest emotion that pain evokes is a fear. When I had extremely bad back pain, when it would hurt, I would almost worry that would I paralyze myself? Would I splice my spine in half?
Right.
And pain reprocessing takes that away from patients.
Okay. Unfortunately, we have to wrap it up, but I do want to point out, Doctor, that you underline the role of exercise as something which needs to be focused on more to relieve pain. You talk about something fascinating called the open label placebo effect, which is essentially a doctor can give you a placebo but tell you it's a placebo. It still has an effect. There's a lot to be explored in your book. Dr. Haider Warraich, thank you very much.
Thank you so much for having me.
The book again is The Song of Our Scars, the Untold Story of Pain. Next up, 23 years ago, sisters Ayda Zugay and Vanja Contino were on a plane to the U.S., having fled the former Yugoslavia as refugees. The woman sitting next to them, who they'd never met, took note of how young and frightened the girls looked and ended up handing them a handwritten note with a $100 bill inside, with the idea of helping them to start their new life in a new country. Zugay has since settled in Boston, but she never forgot about that woman and has periodically tried to find her, most recently a few weeks back. And this time, the internet rose to the challenge. Just a few days ago, Zugay reunited with Tracy Peck over Zoom, and they both joined me via Zoom now. Ayda, Tracy, very nice to see you both.
Thank you.
Tell me,
thank you so much for having us.
What was it like when you saw each other again? Ayda, can you tell me?
Yeah, of course. I was so overwhelmed and, also really touched by this amazing person that almost immediately just spoke with joy. And, Tracy ended up being so far beyond what I ever imagined. And I remember, and it was just so touching that she remembered, every detail, and that she remembered us, and just feeling her warmth and joy was just really overwhelming and really touching.
Tracy, was this something that you thought about a lot over the years?
No, actually not. I was returning from a trip to Paris. I'm a tennis player, and we had gone there to play tennis and attend the French Open. And was on the plane sitting next to these little young girls. And they were telling me their story of how their parents had to put them on a plane to get out of Yugoslavia for their safety and sent them to America. And they didn't really know where they were going, and they were frightened. And my heart just went out to them. I was just so overwhelmed by their story, because I'm a mother myself of 5 children and 7 grandkids. And I just was overwhelmed that those poor parents had to do something like that. And so I just opened my purse when it got time to leave and thought, I have to help them in some way.
And in some reporting, I've seen that you dropped a pair of dangly earrings in also. Is that accurate?
Yes, that is accurate. I wear a lot of dangly earrings. I wear a lot of jewelry. Earrings are part of my dress. So anyway, the girls commented that they liked my earrings. And so I gave them the earrings as well as the $100 bill and wrote the note to them.
Ayda, tell me a little bit about what was going on for you and your sister. A little bit of the story. How did you manage to get on that particular plane?
Yeah, so, it's interesting because the day before we met Tracy, my sister and I left our parents with bombs falling, all around us. And it was very difficult to, sorry about the noise. It was really difficult to even imagine this idea of, this warmth and kindness coming from a stranger. In my country at the time, family and friends were not kind and welcoming. And so.
And you were fleeing Kosovo at the time, is that correct?
I was actually fleeing, and I call it former Yugoslavia because my family's mixed. So we've lived in Serbia, Croatia, Slovenia, and which is why I identify as somebody from former Yugoslavia. But we were fleeing actually the NATO bombing that was happening in 1999 at the time. The NATO bombing did help the country
move forward after everything that's happened. So it's not something that I think it's very hard for folks knowing that it took that act in order to stop the genocide that happened in our country. But there was no safety to be found at all anywhere. So my parents decided to put us on that plane.
And when you got on that plane, did you have any idea what was next for you?
Absolutely not. Even crossing over into Hungary at the time where we flew from, because there was no flights leaving our country at the time that were safe. We had no idea. We didn't have any money on us, actually. We had just enough to cross, safely across the border. There's fees that you would pay to cross every border, just like a visa fee that you need to pay. And we had no money left over. And so we had no clue what we were going to do. We didn't know where we were going to be or live or what the future was holding for us. And so being able to get a chance to talk to Tracy there and just, feel her welcoming spirit, but also the hope that she had for us with that message of like wishing us safety and happiness. I think it really created kind of a goal for me to have safety and happiness here in the U.S.
So Tracy, was this the kind of person you were? You describe it like such a spontaneous act, but is this really the kind of person you always were, someone who reached out to help other people?
Well, I guess I always felt that I am that, hope that I was always be that kind of person. I always told my children, be kind to everyone. Be kind to everyone because you never know who needs help. And we all want to be accepted and loved in life. That's kind of the goal, right? Of being, we're all human beings that want to be accepted and loved. And so I guess I just, after hearing their story, I just felt like this is something I had to do. And so I just did it.
And Ayda, how have you moved forward in life? I believe you're an activist now. What can you give us a sense of what you're doing?
Yeah, it's interesting. My thinking through Tracy's act of kindness, I really wanted to focus my entire career on social impact. So over the last almost every year since, I've focused on really doing that, advocating for people who are most marginalized. Those also include refugees and immigrants in the US. So I'm an elected delegate for Refugee Congress, which is an amazing organization. I'm also a business owner. And so it's been amazing to be able to think through how Tracy's inspired us to pay it forward, to really, the first thing I did the moment I had my foot on the ground is go and work at a refugee camp in Zambia with other refugees. And so Tracy has inspired me to really pay it forward my whole life. And so I really took to heart her message of being safe and finding happiness. And it's amazing to have found that in the US and in Boston. And Tracy has been with me all those years.
It's a wonderful story. It really is the kind of story we all really need to hear right now. Thank you both, Ayda Zugay and Tracy Peck. Thank you very much.
Thank you so much.
That's it for tonight, but come back tomorrow for Talking Politics. Adam Riley and his panel will dig into the new federal review of the MBTA after several recent safety accidents. Plus, Mayor Michelle Wu kicks the race for Suffolk County DA into high gear. That and more tomorrow at 7. Thanks for watching. Good night.